the first inaugural episode of Healthy and Whole in Mind, Body, and Soul. My name is Dr. Leonard Presley.
And my name is Shauni Presley.
And we're so glad you joined us for this brand new show that is intended for a very specific topic. We are here to discuss overall health and well-being. You know, this show is geared toward our community of faith here in the church, but we also want to look at it from a little different perspective. One of the things that many of us are very devout in, we're very devout about our spiritual health. We read our Bibles, we pray, we fast, and we do all of these things to really get into and nourish our spiritual being. But this show wants to make sure that we take care of the entire temple of God, that we make sure that the whole of our bodies, our minds, and spirit can be all together. Because if we want to be good soldiers for God, we want to be good testimonies for God, we want to be a sanctified temple for God, we have to keep his temple up, don't you think?
I believe that.
So that's what we want to really do with this show. We want to talk about how do we make sure we glorify God, not just through our spiritual pursuits, but also in how we manage our health, how we manage our wellness, how we manage our physical and mental well-being, so that the whole of our being can glorify God to the fullest extent. So a little bit about us, and I'll tell you about me. My name is Dr. Leonard Presley. I received my bachelor's in biology and my minor in chemistry from Claflin University. I went on from there to receive my doctorate in physical therapy, and I've been practicing since 2006. I have had the opportunity to practice in just about every medical setting, along with folks from every discipline, if you will. So I've had lots of experiences, lots of different perspectives, and I have always been interested in how do we improve our health and how do we manage it on a day-to-day basis. So I'm passionate to be here. This is something, along with my faith, that I'm very passionate about. So I'm glad that God has blessed us with this opportunity.
Okay, a little about me. My name is Shauni Presley, and I have a public administration degree. And I have experience in health, public health, from food safety to regulations. I was an athlete in college. I played basketball. Right now, I'm really focused on fitness and health for our whole family as a whole. So this is very, very important to me and my family. So
we're so excited to get started. And now what we plan to do is, going forward, we plan to have one show a month to begin with. Now, if the demand is high and you guys put a lot of likes and things in the chat, then maybe we'll go back to our sponsors, who I'll talk about in a minute, and see if we need to increase our frequency. But we really want to make this a place where you can come to get information, education, and just overall wellness, complete holistic wellness approaches that, again, we can nourish our entire being. That's why our title is Healthy and Whole. So, all right. So now about our sponsors, I do want to thank Pastor Johnny Wyatt, Heraclio John Wyatt Jr., and his wife, Sister Paulette Wyatt of the Apostolic Faith Church in Brooklyn. They came to us, approached us, and thought we would be able to pull this off and to do this in the name of God for all of the benefit of the community of faith. So we want to thank them for their faith in us. We want to thank our production team, who will be mentioned in the credits, I'm sure, for taking the time to put this together. None of this can go on without the folks off camera or those who are sponsoring and brought this to fruition. So we want to thank God for them. But tonight we're going to jump right into our topic. Now, March is
Women's Month.
Yeah, guys.
It's all about us.
Fellas, I'm sorry. We got to start with the women. This is their month, so we're going to let them take over. But you know what? Women deserve the credit and the adulation they get.
Thank you very much.
Look, she looked like a queen doing that, didn't she? But the women deserve this month. They deserve every day, to be honest, from my point of view. But we really want to hone in this month, with it being Women's Month, on women's health and well-being. We want to really talk about the factors that may be affecting them, the strategies they may be able to use to make sure that they are the strong queens, Proverbs 31 women that they are designed to be.
Thank you.
Now, I'm going to be honest here, and y'all may not believe this, but I am not an expert in women's health. I'm not.
Thank you.
Why are you saying thank you?
You're a male. I'm a female.
I know that. That's why I told the people that. But what we want to do on the show is not just give you our opinions, give you our thoughts and perspectives. We want to bring in those that are experts in the fields that we're discussing, so that you can get the best knowledge, the best insights, and the best perspectives. So tonight, we have a very special, esteemed guest for our first guest on the show.
Yes.
Dr. Sandler Ray Gordon. Now, this is not a small thing, as y'all can see her there. How are you doing, Dr. Sand?
I am fine. Thank y'all. I am so honored that I'm on y'all first show. So let me just say that first, but I'm fine. I am fine.
Well, I could, as soon as we knew that the first one was going to be Women's Health Month, you were the first one, the first person, the first expert to pop to mind. And Shauni can attest, as we were going through the list of shows, I said, you know what? Dr. Sam would be the perfect person for that first show. But before we jump in, let me give the people a little bit of background. Dr. Sandler Ray Gordon is from Orangeburg, or was born around, lived and raised around Orangeburg, South Carolina. She, like me, is a esteemed alumnus from that college that sits on the hilltop high. I'm on a 2-hour horn right now. Claflin University.
Best school in the world. Best school in the world.
There you go. We're not taking any prisoners tonight. There you go. She also graduated with a biology degree, with a minor in chemistry. She went on to you know what, Dr. Sand, if you will, after your bachelor's degree, tell us where you went through your educational background there after you left Claflin.
Yes.
So after I left Claflin, since this is a show that's, based and rooted in God, which I love, I can take you on the spiritual journey of the entire thing that I did. Actually, while I was at Claflin, I applied to just about all the medical schools. I honestly didn't know what I was doing. So I was like, just apply to all the medical schools. And I didn't get into any. And so I remember being in my dorm room and literally like crying in the fetal position because I didn't know what was going to happen next. I was like, I guess I just got to go home and live with my parents for the rest of my life, which my parents were like, no, girl, that's not your plan.
No, that's not going to work.
So I was laying in my bed crying, and all of a sudden I got a phone call, and it was from this post-bac program in Ohio, at Ohio University. And so they were inviting me to do a summer program with them, and they were like, well, if you do the summer program and you do really well with the summer program, we'll just put you into our medical school. And I'm like, really, God? That's how we going to do it? Okay, just going to throw me in medical school. I'll take it. Because I still to this day have no idea how they got my number to call me. I really don't. Like, this call just came out of nowhere. And so I left Claflin and actually went up to Ohio, and I was there and I did their summer program, and I did really well in their summer program. But the way the program worked was they accepted certain people to go directly into medical school, and then the rest of us had to do a year-long, what they call a post-bac program. So it was basically, I can't even remember how many classes was, but it was basically classes that would prepare you for medical school. And all you had to do was get a 3.0. And if you got a 3.0, then they would put you in the following class. So that's what I had to do. So as you said, we went to Claflin, and what we had was semesters, but what they did was quarters. So before I blinked my eyes, we were already finished with a whole quarter, and I wasn't used to it. And so my first quarter, I'm not going to lie, I bombed it, y'all. I bombed it. Because it wasn't I didn't know the information. It's just I felt like I didn't have enough time to learn everything. So I went home completely defeated, and then I came back renewed, and my last 2 semesters, I actually made a 4.0. But I bombed it so bad the first time. I bombed it so bad the first time. So I actually missed getting into medical school by 0.04 points.
That's heartbreaking.
I spoke to the dean, and he really did like me. He was like, I see something in you. He was like, so I'm just going to put you into medical school. You'll thrive here. We see how you were able to, pick yourself up. Well, this can also be a lesson. And don't, how your mom say, don't run your mouth to everybody. So I ran my mouth to one of my friends who didn't get the GPA also, but she missed it by like 1 whole point off. Like, she really bombed out like all semesters. And so she called the dean behind my back and was like, well, if you're going to let her in and she didn't make a 3.0, then you have to let me in. So then the dean called me back and was like, well, she has a point. Like, you technically didn't make it. She didn't either. So I'm rescinding my offer to you. Devastated. Devastated. And my mom was very, very upset with me for doing that. She was like, that's what you did for running your mouth. But she was my friend. So anyway, I stayed there for a year. I worked. And then long story short, somebody who did the summer program with me, actually, he got straight into medical. Well, he actually did the post-bac program, got into medical school there, but he decided to go to medical school at a new school at Virginia Tech. So he was just like saying, you're brilliant, you're smart, I'm going to get you into my school. So he talked to some people, and like through a whole bunch of divine intervention, they opened up their application process just for me, interviewed just me, and I ended up getting into medical school at Virginia Tech. So that's how I ended up at Virginia Tech. And then from there, a whole bunch of other stories like of divine intervention. I ended up going to my residency in New York City, well, in Queens, New York. So that's where I completed my residency in obstetrics and gynecology.
Awesome.
That's
awesome.
a great story.
A story of faith that brought about a career's
Yes.
worth of expertise and education. Beautiful, beautiful, beautiful.
Yes.
So lucky. See, that just shows how blessed we are to have you as a part of our show. So, without further ado, we're going to get right into trying to get these folks to understand women's health. So, I'm going to turn it over. I'm going to let the ladies take the floor. I'm going to sit here and just
Not
kind of
too
go
much,
for the
not
ride.
too much. Well, let's get into the first question, which is, in your recent experience, what are the most pressing issues facing our community regarding health?
So, as I said, I'm an obstetrician and gynecologist. So it's really two answers to that. So from the obstetric side, the biggest thing that is affecting our community is the maternal mortality rate in the United States. Black pregnant women are dying at a rate of 5 times more than white women, 3 to 4 times more than Asians and Hispanics. But basically, we are the race that's dying at a higher number. And there are a lot of things that can actually attribute to this. But the real core of this is implicit bias and racism. And not racism that just started today, but, things from years and years ago, where our hospitals are, where Black people were allowed to live. So that decreased the access that we could have to hospitals and physicians and things like that, and it affected our health. So that's kind of like the core of it. But kind of like looking at the surface of it now, again, like I said, it's access to care. It's, our health, we're not the healthiest. And that's, really and truly, our diets are completely different. So that kind of plays into it too. So from the obstetric side, it would be the maternal mortality rate. And then from the gynecologic side, it's more so of things that really affect us are cancers. And again, that's because of access to care. So we're not really getting the preventative care that we really should be getting. Preventative care like mammograms, preventative care like pap smears. And then also, I have so many of my patients who come in that look like me. They're 65 years old and they'll be like, oh, I'm now having my second period. And I'm like, well, what does that mean? They're like, oh, well, my period stopped when I was about 50, but then it came back again 5 years ago. So they don't realize that should not happen. And that is actually a sign of uterine cancer. So really and truly, that's one of the biggest things that I feel plagues the gynecologic side is cancers. And it's more so we're just not getting our preventative care as we should.
Wow. So now, as far as what, a lot of these kind of the institutional things you alluded to, we know there's lots of things going on. We've all seen things going on with the media, social media, with some of the activism. But when it comes down to us as a community, what can we do? What is the best approach for us to begin to, what do people need to know first to start on this journey to taking better charge of their health when it comes in regards to women's health?
Yes.
Well, one thing that we need to recognize is the fact that we're not invincible, that we do get sick, and that getting sick can really lead to death. And I think that some things that we've become so accustomed to we just, kind of poo-poo it off. I'll never forget my internship year, and I saw this young lady and she was in her 20s and her diabetes was completely uncontrolled. It was horrifically uncontrolled. And when I sat down and I spoke with her and just asked her, why aren't you taking your medications? Why aren't you doing your finger sticks? And her honest answer was, she was like, well, my grandma and my mom had diabetes and they still living. So, what's the big deal? So they really she really honestly didn't grasp of how sick she was and how it would really and truly affect her life. And I really had to sit down with her and I was just like, you're probably not going to make it, to 40. And I was like, and if you do, you're going to be on dialysis. Your kidneys are going to be shot. So I really think that that's kind of the first thing that we really need to do. We need to really accept the fact that, we do get ill. And when we do get ill, we do need to seek help. Just, I know we're a people of faith, but, just praying in a way that doesn't work. Of course, prayer works, but, prayer without works is dead. It just really and truly is. So it's really and truly, one, grasping the fact that you are worthy of taking care of yourself and actually going to the physician. The second thing that I always tell people to do is be knowledgeable about yourself. Like, ask questions. Don't be ever afraid to ask your physician questions. And a lot of people always apologize to me. Oh, Dr. Gordon, I'm so sorry I'm asking you this. I'm so sorry I'm taking your time. But I'm like, no, I was like, I want you to know these things, because what if I'm not your doctor forever? And two, what if you're bringing up questions that I'm not even thinking of? Like, so it helps me stay on my toes also, because I'm not above saying I don't know. I'm not above that. If I don't know something, I don't know it, and I'll go read up on it, one, and I'll send you to a person that knows more. I do, I tell people I do boobs to pubes. That's just all I know. But if you come to me with a nephrology question or a kidney question and I don't know it, I'll answer to the best of my ability, but it's my job to get you to a nephrologist. So really and truly come in with questions, and don't leave until your questions are really and truly answered. And if you don't feel like your answers were adequately answered, your questions were adequately answered, or you don't feel like you're being heard, it's okay to get another doctor. Like, that's another thing. People stick with bad doctors all the time. Oh, so-and-so never listens to me. He or she never gets my blood work. I told her that my blood pressure was really high and she didn't do anything. I'm like, but you kept going back. And they're like, yeah, I just didn't feel like finding another doctor. That don't make sense. It just really and truly doesn't make sense. So those are like the two biggest things that I tell people to do. Like, one, acknowledge the fact that you are human and that you do get sick. And when you are feeling sick, you need to do something about it. And two, ask questions. It is okay to ask questions. Don't just go to your doctor, sit there, let them do things to you, and then you walk out the door. That's not taking grasp of your own health. It's really not.
Oh, wow. That's so basically what you're saying is you're telling our women that it's not okay just to live sick, and you're not supposed to think this is just life and I'm not supposed to do anything about it. And it's amazing that well, let me ask you, Dr. Sand, maybe you've had conversations that lead to this, but where does that mindset come from, that this is just my life and I'm just supposed to be sick? Have you ever heard people explain why they thought that way? So
one, people don't really see themselves as sick. You know what sick is because, you're a doctor, and I know what sick is. But like I said, when I was trying to explain to the young lady that diabetes was a bad thing, she was just looking at me like, but everybody in my family has it. So what's the big deal? So it's really trying to like beat into their heads, like, you are sick. I can make you better. These are the ways that I can make you better. And then also, it's just a generational thing. Like, your big mama was obese, your mom is obese, your sister obese. Now I'm going to be obese. That's just a lot that I've been given. Big mama had heavy periods. My mom had heavy periods. So I got heavy periods. And so that's just what we do. Like, all of us just have heavy periods. I hear that all the time. Oh, well, my mom has heavy periods. And they're just like, so I just thought that I would have heavy periods. But then I do an ultrasound. I'm like, girl, you got these huge fibroids. Like, we can do something about it. You're not supposed to have heavy periods. But they just think they're supposed to have it because everybody else does.
Mm-hmm.
Do you think that a lot of the women that you come in contact with, it could possibly be the educational level with some of them? Because it seems like some of them may not have the understanding that certain things can affect their bodies, or they saw something that felt something weird, that they just bypass it because of the lack of education.
So it really goes two ways. So can lack of education cause women to neglect their health? Absolutely. If you don't know what's wrong, then you're just not going to recognize what's wrong. But with that being said, I also have women who I find who are highly educated, who are doing the mostest. And so they prioritize everything else but their bodies. So by the time they come to me, like, they're just like, oh, I was working, I had, my kids, my husband, like, they prioritize everything else. I was in school. So it's really different reasons why people who are highly educated neglect their health versus people who, aren't, like, when I say educated, I mean like books or schooling. It's just different reasons why but both of them I will find them totally neglecting their health, and they just have different reasons to do it.
Well, how would you, because you've been in it, you've experienced it, you're a mom, how do you balance that?
So it's really not, so one thing that I talk to moms about all the time is it's not really about balancing, it's about prioritizing. I don't think balance is a thing. I think that it's something that's beat into women because I feel like we're supposed to be all the things at all the times. We're supposed to be like, a good wife at the same time while we're being a good, whatever you work at, while at the same time you're also supposed to be a good mom, and you're supposed to balance this out to 100%. And I just don't believe that that works. And of course, I was told that, and I believed that for many years. So it's not really about balancing it. It's about prioritizing it. So you need to I have so many planners. I'm like the planner queen. Get you a planner, or we have phones now. Really and truly put into your phone, put into your planner that this is the day that I'm going to take care of my health. I see a lot of women and they get everything done on the same day. They come see me, then they go get their mammogram. And if they're older, if they have to get a DEXA scan, they'll get it. If they're up to date on their colonoscopy, of course they don't. But it's just they plan a date and they're like, this is my health day. And I'm like, that is what you should do. You have to prioritize it. Say that above everything else that's going on today, I am going to go see my physician to follow up on X, Y, and Z, instead of trying to balance it out. Because when you balance it out, you get completely overwhelmed and something's going to fall through the cracks. So you never want to be the thing that falls through the cracks. You never want your health to actually fall through the cracks. So I tell women, don't try to balance it. Just flat out say babe, I know that this was going on today, but this is the day that I actually have my appointment. And don't get into the habit of changing it. Just say that this is my day. Either you work around me, either you change what's going on, or, I'm just not going to be there, because I have to prioritize my health. Because when you start canceling things, if your office isn't diligent in calling to reschedule, you're not going to call to reschedule. Once you miss it, you miss it. It's done. You've missed your appointment. You're not coming back. Versus if you go spending 30 minutes or an hour, however long, with your physician, now it's done. It's really and truly done. So I tell women, don't try to balance it. Just prioritize it. Put it in your planner and say, this is the day every single year that I'm going to get my pap smear, my mammogram if you're over the age of 40. Or any other testing that you have to follow up on. So that's really and truly what it is. Just prioritize it. We have to prioritize ourselves. And as women, society makes it seem like we have to prioritize everybody else. We're the ones that's supposed to lift and keep everybody else going. But we really need to kind of take a step back and take care of ourselves.
You're so right.
I definitely like that thought of prioritizing. And I like how you explained it, because it doesn't seem like, okay, I'm going to neglect my family or my job. I'm just going to make sure that those things don't stop me from taking care of myself. So now, have you ever had any patients that you've had to refer for mental health reasons when they come into you? Have you had warning signs that say, you know what, you may need to go see a mental health specialist? And if so, what were some of the warning signs that kind of pointed them to that specialist for you?
So all the time, I tell people that I practice obstetrics, gynecology, and then gynechiatry. I am definitely, I do. When I tell people that, they're like, you should pin that. And I'm just like, I thought everybody said it, but they're like, no. But really and truly, I think that there's just a certain bond that, women can really have, because we can relate to each other on just a different level. And so it's more so, it's I don't really look for, they're blatant signs. So it's blatant signs that anybody can pick up on if somebody is depressed. But it's more so, I talk to my patients and I just ask them flat out, how are things going? How is your, do you feel depressed or anxiety? And then I go through examples of what depression and anxiety looks like. And when it's actually they admit to it, or they might say what I was diagnosed with that when I was a teenager in my 20s. And, I ran out of my medications and I just stopped taking my medications. I never followed up with my doctor. And so when I ran out of refills, I just ran out of refills. So it's more so of just really sitting there and talking to them and kind of pulling the information out of them. And then once it is recognized, where I actually practice at on the Eastern Shore in Maryland, there are resources. And so I just make sure that I can plug them into those resources, because I'm definitely not the person to go to actually manage mental health. There's some things that I can do as far as postpartum depression that I am comfortable with, but some things I'm not comfortable with. And again, I'm okay with saying I don't know, or I'm not great at managing it. So I definitely plug them into the resources that we have out on the Eastern Shore to make sure that they are being taken care of. And then I do follow up. Like I say, okay, I know you're going to have follow up, with your mental health provider, but I want to see you back in a month, because I want to see that, yes, you did go, because in a month they'll come back and I'll be like, did you go? And they're like, no, I didn't go because, again, so-and-so came up. And so I have to beat into them that mental health is very, 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 very important.
So I just want to throw this out there, but with COVID and all that happened last year, how did women's health for you change with the people that you were seeing, how you had to communicate with them, how you had to just look outside the scope of what you were normally used to?
So the way that we actually pivoted is, so we did, when COVID first came out, we had no idea what we was doing. And it's kind of like the anniversary of it all now. So it's funny to see my patients, like now I'm like, you're like my last patient that I saw before we shut the office down. So what we did was, as far as women who were healthy and weren't having any gynecological problems or anything like that, GYN, which is like well woman visits, we did push those off so we could make sure that we could pack our office with like our pregnant women, because I do obstetrics too. And we can't tell our pregnant women that, we're shutting down the office, due to COVID, we don't know what's going on. So our healthy women, we did say that, okay, for our, full GYN exam, as long as you're not having any issues, no pelvic pain, no abnormal bleeding, discharge, you don't feel any masses in your breasts, in your belly or anything like that, you are literally just a healthy woman with no issues, then we did push them off until the fall, because that's just when everything kind of started to open back up and we had a little bit more of an understanding of what COVID was. So we just really switched over to being very heavy with our obstetrical patients in the office. And then we did see our GYN patients over telemedicine. So if we did a telemedicine visit with them, and then we did find their issue did warrant them coming into the office, then we would tell them, okay, now you need to schedule a visit in the office. But, like some women would call in and they'd be like, I just need my birth control refilled. So things like that, there was no need for them to come into the office and end up exposing themselves to COVID coming out their house, coming into our office and things like that. So we did kind of like the in-office and relied heavily on telemedicine to weed out who needed to be in the office and who didn't. But most of our obstetrical patients we kept in the office.
That's awesome. Now, with telemedicine, with the explosion of telemedicine because of COVID, do you think that's a tool that folks should use to maybe make getting access to their doctors more convenient? Because one of the main reasons people push off, and I know women push things off because they have so much else going on. Yeah. Do you think that option of having telemedicine there it should be a valuable avenue for them to exploit to help with their health?
Telemedicine, we should have been doing it 100 years ago. Once we started doing it, I was more so upset with myself that we weren't doing it. Like, I was like, why is this something that it took a whole pandemic for us to start doing? It changed health for so many women. Again, like I work in a rural area. And so to get a woman to, take a day off work just to come and see me for 15 to 30 minutes or whatever was hard versus I've had so many funny conversations with my patients. Like they sneak off to the bathroom, they run to their car, just to have these telemedicine visits. And they were so beneficial to them because like, again, you don't know what's wrong until someone tells you that something's wrong. So they would call in and just be like, hey, like I said, the second period thing is going on, or I've been, my period has been on for 20 days. Like, should my period be on for 20 days? Oh, wow. And so it made it easier for them versus that 20 days would have easily turned to 40 days because they would have just been like, I don't have time to get off work. I can't come and see you. And what if I come and see you and you tell me there's nothing wrong? So they're like, I can't risk it. I have to work. I'm the only one that's providing, money to my family. I am the sole provider. Or even if they weren't the sole provider, their paycheck meant a lot to them because they were getting paid by the hour. If you don't work, you don't get paid. And then also where I work, some of our patients have to travel like 30 minutes, 45 minutes, an hour. Some of our patients actually travel 2 hours just because they really love our office. So to give someone the option of, you can just hit me up on, telemedicine and we can have this visit that doesn't warrant you coming into the office. It has completely changed the game. And it is something that I'm really trying to make sure that we keep implemented into our offices because it's definitely a tool now and it is definitely getting more women seen for issues.
That's awesome.
So I have a question. This is just a question of like physical health. So as you get older, and I've noticed as I gotten older, it's harder to lose weight. It's harder to, I'm doing the same things, but I'm not, the weight isn't moving as fast. Like people would always ask that when women come in and they ask those kind of questions, what are the things that a woman should look for to see how can they help themselves work out their, I guess, their weight issues.
Right.
So definitely our metabolism does slow down. Our metabolism does slow down. The older that we get, our metabolism slows down just for different reasons of what's actually driving our metabolism. So it does slow down. But I tell women, I think that the first thing that we always think of, and me too. So when I'm saying we, I mean like I am included in that we is, okay, well, I'm just going to work out more. And if I work out more, then I'm going to lose weight. But as we age, we really and truly have to pay more attention to our diets. Like, when we were in college, we could eat a whole pizza at, midnight and still be skinny. Like our metabolism was at its best. Now we can't do that, y'all. I can't do that. I mean, if I eat a piece of pizza, I'm gonna gain 20 pounds the next day. That's just what's gonna happen. So definitely I tell women, like, believe that 80-20 rule. That 80-20 rule definitely comes into play when it comes to weight loss and weight maintenance. And the 80% is your diet. You cannot eat the same way that you used to. You really and truly have to find a healthy diet that actually works for you. So when I say diet, I'm not talking like starvation and things like that, but definitely, like some people, you have to figure out like, do you need carbs? Do you need more or less protein? So I tell people to really take time to really figure out what's a better diet for them versus what's the new Beachbody workout program, because that's just the 20%. Like I've lost weight just changing my diet and going walking for 30 minutes a day and lose weight. So it's really and truly not the exercise part. It's just really and truly you have to now kind of like work with your metabolism.
That's nice.
I'm going to ask this question. Now, you kind of alluded to this a little earlier, and I know telemedicine has brought more of this into being. But now, how important is it for women to self-monitor for signs and symptoms of things that they might not know about? And what should they be looking for when it comes to, I hadn't been to the doctor, but this thing is going on. What should they be looking for?
Is there like a checkbox that they can check off?
So definitely, like as far as like, like I said, I can tell you from boobs to pubes. I can't tell you all the other stuff, but I can tell you that. So like you should definitely like what you call it, I don't want to call it a protocol, but something came out, I can't think of the word right now, but basically a guideline came out saying that women should not be doing breast examinations anymore because it was causing more false positives and more mammograms and things like that. Okay. But I don't subscribe to that. I'm just like, we just have to teach women what they should actually feel for. So starting at your breast, you pick a day out of the month and make sure that it's the exact same day every single month, because due to your hormones, your breast tissue actually fluctuates as far as how it feels. Sometimes of the month it feels a little bit bumpier, it feels a little bit more full, it feels a little bit more like fibrocystic under it. So if you're going to say like every month on the 3rd, I am going to do a breast exam, then just make sure it's the 3rd, because around that time, you're always going to be in the same time for your cycle. So that would be the first thing. And if you notice anything that is troubling, and what troubling means is you feel like a marble that's under your breast, or you feel like a lump or a mass and it has some pain to it, or, your breast, you're having leakage from your breast, whether it's clear fluid, which is actually a good thing, or green fluid, which is still a good thing, which is weird, but it is, or bloody fluid is when we start to get really concerned about it. But if you have really and truly any discharge from your breast, it's better for you to come to your GYN so we can tell you everything is fine versus you assuming it. As far as your nipples are concerned, if your nipples were always out and all of a sudden they're starting to what we call invert, so now they're always in, that's a sign that you could have like a mass that's actually pulling your nipples in. So really and truly look at your breast, feel your breast, and know, like, what is your normal. And whenever you get off your baseline of your normal, go in so we can actually say like, oh, this is just your fibrocytic tissue, it's nothing wrong, or yeah, let's get a mammogram or let's get an ultrasound of that. Any pelvic pain that you may have. So if all of a sudden it feels like whenever you urinate or you have a bowel movement and you feel like pressure in your pelvis, that is definitely something that needs to be checked out to, one, make sure that you don't have like any urinary issues that are going on, or maybe you do have a uterine fibroid or something that is causing pressure there, or, masses from your ovaries. So if you ever feel like pelvic pain, pelvic pressure, that's definitely something that you want to get checked out. And then also abnormal bleeding. A normal cycle with someone who is not on any contraception at all is really 28 to 35 days. So it's not that that's how long you should bleed. That's just from the first day of your period to the next first day of your period. Normal is between, I said 25, actually 28 to 35 days. So that's normal. So if you're noticing that, God, I'm getting a period every 18 days, that's not normal. Or I get a period every 70 days, or I skip 2 and 3 days of my, 2 and 3 months, of my period. That's not normal. So definitely pay attention to that. Like, your period doesn't have to come on the 17th of every month. It doesn't. But as long as it falls in between that 28 to 35 days, that's fine. But when you start to kind of like wander out of that, then you definitely want to get that checked out, especially the older that you get, because again, those are signs of possible like uterine cancer or abnormal cells that aren't really cancerous, but that can actually develop cancer. But if we catch them quick enough, we can actually do things about it. So those are the biggest things as far as like, for women's health that, I know about. Now, of course, if you're having like other things like, headaches, blurry vision, ringing in your ears, chest pain, things like that, those are always things that you want to get checked out. If you have a headache, you take some Tylenol, it goes away. Okay, that's fine. But if you have a persistent headache, get that checked out. Chest pain is never normal. It's just not normal. So if you're frequently having chest pain, that's definitely something you should get checked out, because women are the highest to suffer from cardiac abnormalities, from heart disease. So we have a whole month devoted to us. I think it's the month of October when we all wear red, just because cardiac health in women is, really because we just ignore the signs. So definitely that's something that you would want to look for, like as far as outside from boobs to pubes.
Great. Now, we talked about mental health earlier, and I know this is, one of your specialties. I want to plug the podcast here. I'm going to let you plug the podcast, but how do you balance all of the mama, career, family? How do you balance it? And talk to us a little bit about the Mature Mamas podcast.
Yes.
So how do I balance it? I don't. Like I said, I prioritize it. Whenever I say that today is the day that I'm doing the podcast, today is the day I'm doing the podcast. Like, I tell you, my husband out there with the kids. So it's just like, I'm not like, hold on for a second, y'all. Let me go and make them some dinner. Okay, can you give me a second? Let me go run their bath water. Like, no, I have prioritized this, and I've made sure that things are put into place to where I can prioritize having this great conversation with y'all today. So that's really what I do. So when I have an OR day, like I prioritize OR day. Like, Lola, she's the one who comes to work with me, or she's the one that's with me across the bridge. And so if I know that my OR day, I know it's going to be a late day or things like that, I don't want to be sitting in the OR thinking about her, like, am I going to get out in time? Like, is her daycare going to close? Blah, 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 blah. I set things into motion to say like, okay, Jason, Lola has to stay on this side of the bridge with you today. Or are you going to be able to pick her up by this time? Because I can't not operate today. Like I have, 8 cases, 5 cases, and I can't say, oh, well, Lola's school is about to close, so send my other patients home. So when I prioritize OR day, it is OR day. The same thing with my kids. Like my job knows that I'll tell them like, today is my son's program, is an academic program. Don't call me for nothing. Don't send me no emails for nothing. Don't do it. Like, don't try to say like, well, what time is his program over? Because we want to see if we can fit a No, like I am prioritizing my son today. This is his day. This is his moment. And I'm not going to let anything else get in the way of it. So that's really how I kind of like get things. And it helps with mommy guilt, because I think that when you try to do the balancing thing, that really does feed into this whole, notion of mommy guilt, which I don't like. I hate when people try to like make mommy guilt this big thing. But that's how I'm just like, I don't feel guilty when I'm not at my son's like, basketball game, because I knew today that for X, Y, and Z, I prioritize being in the office today. And this is why. If I wanted to be at my son's game, I would be at his game and I wouldn't be thinking about the office. And so it's more so of just kind of like prioritizing how my day is going to go and don't let any emergencies happen. Of course, if my son chopped off his arm, I'm going to leave the OR. But, like other than that, it's just like, I don't feel bad. Like they're like, oh, Dr. Gordon, you're going to get out of here late. And by the time you get home, your kid's going to be asleep. And I'm like, probably. Like, I don't have guilt about it because I already prioritized that today is the day I'm going to be in the OR and I'm probably going to be in here late today. And I'm okay with that. I'm not going to make myself feel bad that, oh, I didn't, tuck my kid in. They got a whole daddy. He can tuck him in or whatever he do with him. So, I mean, that's really and truly like how I kind of like prioritize the whole thing. As far as the mature mommy life, mature mama life, that is my podcast. And that was really birthed from the maternal mortality rate in Black women. That's really where it came from. Because I felt that the true not really the problem, but the way to help fix this is to educate women. So a pregnant woman could walk into their doctor's office and their doctor gets their blood pressure. And if their blood pressure says it's 160 over 100 and their doctor says, okay, see you in a week, they will be able to say like, okay, no. Like I listened to a podcast, Dr. Sand said that my blood pressure should be less than 140 over 80. Now you're trying to send me home and my blood pressure is 160 over 100. Like, what are you going to do? Am I going to get some labs? Is it time for me to have this baby? Are you about to send me to the hospital? What are you about to do? So I don't want women to become obstetricians, but I do want women to be better educated so they know when to kind of like put their hands up and say, this isn't right. This doesn't look right. This doesn't feel right. Something is wrong here. If they have a baby and they're pouring out blood and blood clots and, their nurse isn't coming to check in on them, they know that, what, I'm bleeding a lot. I'm not comfortable with this. Before things get really bad, they can actually say like, hey, I have a lot of bleeding. Can you come check me? Can you get a doctor to come in here and check me? Something's not right here. And so that's where the podcast actually came from, because yes, I can say like, to bring down the numbers. Let me go fix all the hospitals. Let me, cure racism. Let me get rid of implicit bias. But I can't do all of that on my own. But what I can do is educate women. So when they come in the face of being mistreated because due to possible implicit bias or racism, or if someone tells them that, yeah, you can have your baby at home, they can be like, well, I had 3 C-sections, I'm morbidly obese and I have high blood pressure and I got a pacemaker. You telling me I can have my baby at home? So they'll be able to say like, because there's some, like people that like, that'll do that, like lay midwives. They'll tell like anybody can have a baby at home. Actually, they can't, not without dying. So they'll be able to like make the educated decision of, what, maybe I do need to have my baby not only in a hospital, but in a high tertiary hospital. So that's where the maternal mama life came from. Just trying to get the information out there for women that I felt just was completely lacking in talking even to my own patients and them just not being a part of their healthcare. I would be the person seeing them their entire healthcare, and then I would ask them like, oh, okay, well, tell me what was your GBS status? We did your cultures 2 weeks ago. Was it positive or negative? And they're looking at me like, I don't know, Dr. Gordon. And I'm like, well, why don't you know? Because what if you don't deliver with me? Like, what if you end up across the bridge in Baltimore, DC, and they ask you these questions and you have no idea, like you've been taking care of your entire prenatal, like you've started at 6 weeks and now here you are at 39 weeks and you've gotten great prenatal care, but you can't tell anybody about your prenatal care. I was like, so do you want someone treating you normal when you're completely abnormal, when they should be doing different things for you just because you have these abnormalities? And they're like, you know what? I never thought of it that way. So it was really birthed from how can I start like at the foundation, and really and truly the foundation is the woman. And the more that I empower her with her own information and empower her voice to actually speak up for herself, I think that will help save a lot of women, because again, they'll know when to put the brakes on, or they'll know when to say, this isn't normal, something's wrong, and you need to be doing something about it.
Awesome.
The awesome thing about that, when you talked about the blood pressure thing, when I was pregnant with the twins, I was looked completely healthy.
Yeah.
And the doctor, my current doctor, looked at my blood pressure and was like, everything's all right.
Yeah.
But what did the other doctor say?
And the other doctor wouldn't have said it unless I was sitting in the room, because Shauni makes me come to all of her appointments because she said, I don't know what to say. You do.
Yes.
And when I was there, I was like, well, doc, you said her blood pressure was a little high. And he really pushed back on us. He said, I don't think anything's wrong.
Yes.
And the next time we saw the other OBGYN, and I asked that question again, I said, the last time her blood pressure was a little high, what's going on? And she started digging into it, and she diagnosed you with preeclampsia.
Yeah.
And they actually kind of had a little office spat. He was like, if you want the patient, you take her.
Yeah. She took me for the rest of the pregnancy.
And it was a blessing she did, because we ended up having to have an emergency C-section and 4 units of blood and premature 6 weeks.
Yeah, your podcast.
That's why we die. That's why we die. That's literally why we die. Like preeclampsia, it is a process. It's a disease process that doesn't go away like a headache. It's not like, oh, on this visit I got preeclampsia, but on my next visit it could be gone. No, the treatment for preeclampsia is delivery. So you will continue to have preeclampsia until you deliver that placenta. And so for you, by the grace of God, thank God that you even made it another week. Because that's a critical week. Like a lot could have actually happened that week, but that is really actually why we died.
Actually cut it by like 3 days or 4 days, and I want you back at this certain day. And then when we went in, she said, you're having a C-section on this day.
Yeah. So, I mean, and that's good. And then you brought up another good point. Like, thank God that you had an advocate there for you. I tell my patients, and I think COVID was, it was bad in a lot of ways. But of course, with, patients not being able to bring in someone with them, because again, we were trying to decrease the exposure as much as possible. So we weren't having a whole bunch of people in the office. We were just like, you could come. But I was telling patients, I'm like, I don't care if you video chat me. I was like, pull somebody up on video, pull somebody up on speakerphone, because sometimes they get home and they forget something that I said, or they forget to tell me something. And the one story that I can just remember off the top, actually I could think of like a bunch of stories, but one of them is this woman who wanted to attempt having a big baby. Like her baby was already big and she really and truly was afraid to have a C-section. It was really back and forth. And I wasn't saying that I wanted to cut her at all, but her baby was measuring 11 pounds already. So it was more so I was just like, you know what, we can do a trial of labor. And if you deliver your baby vaginally, that's fine. I was like, but these are signs that we will look for just in case we see that your labor is stalling, blah, 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 blah. This woman was walking out the door and her husband was on speakerphone. And he said, you remember last time the doctor said that the baby was too small and he had to use forceps, and he ended up like breaking the baby's clavicle and it was hard to get the baby out and blah, 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 blah. I almost fainted. I was like, excuse me? She was like, you know what? That did happen. She was like, I totally forgot about that. She was just like, yeah. I was like, well, how big was that baby? She was like 7 pounds. I was like, so we had to struggle to get a 7-pound baby out? And you think that you can push this big baby out? So, but she totally forgot it. I've been seeing this woman, I think since about 35 weeks. So I wasn't seeing her entire pregnancy, or 32 weeks, but like seeing her enough to where she could have like brought that up. Like she never said it. And she ended up going to the hospital and she decided that she didn't want to have the trial of labor and ended up having a C-section. That baby was almost 12 pounds. And I was like, imagine that baby getting stuck. Like, I don't know if your baby would have survived that. So absolutely, like having advocates is so important. It is so important because it's so much information that we can get from advocates. And there's so much information that even my patient, again, they'll just forget and they'll get home and then like, hubby or girlfriend or, wife or somebody will just be like, oh, remember they said X, Y, and Z. So definitely, like, I'm glad that he was there with you.
Awesome. Well, Dr. Sand, I want to say a big giant thank you. You have been, I don't think we could have had a better first guest.
No, you're amazing.
I'm so honored. This was the first show. I didn't know it was like the first show. I didn't. I knew it was a new show. I didn't know it was the first. So I am so humbled and honored that I was your first guest. And hopefully this will not be the last time that we have this meeting. I really enjoyed this.
Right. Well, now I almost forgot something. Not only does she do the podcast, but there's a product line that comes along with you. You want to tell us a little bit about the product line? You my girl. I'm about to go back to laughing now. You my girl.
Like they're like, how is she prioritizing? She doing too much. So I do have I have a hairline too. So I actually started and it's natural products. So of course I have natural hair. Whenever I say natural products, people think that it's for only people that have natural hair, and it's not. It's for people who want healthy hair. So I started a hairline while I was in residency, and that was really born from me damaging my hair. And so I have a hair care line, and then from that I actually created a skincare line, and then from that now I have a beard care line. But it's called Dr. Coily because I'm a doctor and I have coily hair. So you know what? Actually, here's one of my boxes. So this is what is Dr. Coily. And that's actually the website also. So the website is www.drcoily.com. And it's another one of my babies. I actually kind of call it, it's almost kind of like my second baby because I had LJ first, and then I had Dr. Coily, and then I had Lola. So it's a labor of love. I make all the products by hand. It is not something that somebody else makes for me in some factory somewhere and I just slap a label on it. I literally have formulated all of these things. I don't want to say on my own because I really and truly did pray about it. I was like, you know what, God, give me what I need to, help not only my hair be healthy, but other women's hair be healthy. So I mix it myself. I pour it myself. I put the labels myself. I actually have orders that I have to do tonight myself. But that's another thing that I do.
Awesome.
Wow.
That's the whole gamut.
Wow.
That's the whole gamut.
I've learned so much. You're amazing. That's all I can say.
Well, and I am so glad that you were willing to come and help share and educate and inform our audience. We'll definitely have to have you back on again.
Yes.
Now, this segment of the show we're getting ready to go into is called our Healthy Living Daily Tip, okay? So, Dr. Sand, if you want to jump in, well, after you hear this, you're welcome to do so. But every month, we want to do this one little thing that you can incorporate into the normal busy day that helps us be more healthy and more fit. So, this month, we're talking about exercise snacks. Exercise. Have you ever heard of exercise snacks, Dr. Sand?
I have. No, educate me because I like snacks.
I'm sorry, it's not that kind of snack. I wish it was.
Oh, it's not.
But,
Okay.
yeah. But exercise snacks are a group of researchers at Harvard did a study, and they looked at short 5 to 7 minute bouts of exercise interspersed throughout the day, maybe 3 or 4 sessions a day. And they found that people responded, their exercise response, their fitness level was equivalent or very comparable to those folks that had these regimented 4 to 5 day a week, hour and a half long sessions.
So it's like me.
It's like you.
They're working out like me.
Yes.
For just 5 minutes.
Yeah, but look, it was It was 5 minutes throughout and interspersed throughout the day, and they found amazing health benefits, especially based on, okay, I'm too busy to go to the gym today, or this happened and I can't do my workout today. They found that if you inject these exercise snacks into your day, you get the health benefits, the cardiovascular benefits were there, the muscle density or the muscle strength benefits were there. Now, of course, those folks that did have the regimen, they were more fit.
Thank you.
They were more fit. Now, I'm not going to say it was exactly the same, but they were more fit. But when it came down to just the presence of the health benefit of exercise, those small exercise snacks were found to be extremely effective.
Give us an example of what a snack is. What kind of exercise?
Okay, so an exercise snack. Here I have my smartwatch on, and I have timers set in there, and I have this one exercise that's called my 5-minute workout. And I do it in my office when I get a break. So basically, I will do 30 interchangeable or alternating sessions. I will do an exercise for 30 seconds, rest for 30 seconds. So I may do 30 seconds for jumping jacks and then rest, and then 20 seconds of push-ups and then rest. And then 20 seconds of marching. And then, so basic body weight, no equipment, just movement exercises that are targeting muscles, but it only lasts 5 minutes.
Okay.
So I close the door to my office, I do my 5-minute exercise, I go get some water, and I come back and I go back to work. I do whatever else I'm doing, but it makes the body respond to that bout of exercise. And if you get a couple of those a day, there's real benefit to it. So too busy to exercise at all? Try the exercise snacks. What do you think, Dr. Sand?
I actually think that's great because, like, one of the excuses that I use for exercise is I'll say that I want to do, like, I have the Peloton. So I'm like, oh, I really want to do a 30-minute class. But then I realize, like, oh, I don't have 30 minutes, blah, blah, blah. So instead of me taking 5 minutes, I just don't do nothing. I just don't do anything.
Exactly.
I'm like, well, if I can't do the 30 minutes, I'm going to do nothing. So that I really do like that concept of, as long as you're doing something, like, just get up and do something. So I actually do. And it get like, and no matter where you're at, like, even if it's like, you know, jumping jacks, some squats, like, you don't need a lot of room to do 5 minutes of exercise. I like that.
Exactly. So for all of our folks out there, before you get your regular snack, do an exercise snack.
Try to make it a healthy snack.
Like I saw your post the other day that you were hungry and was hoping Lola hadn't eaten her carrots.
She ate them.
So yeah, she ate them. The one day you hope she didn't, she did. But
so sad.
Before you go eat your carrots, do your 5-minute exercise snack, and we can be healthy, and we can get those benefits of moving a little bit.
If we kind of put it together, you get a snack, and then we do an exercise snack. Yeah. Put them together.
But make sure you don't get like cookies, because that kind of defeats the purpose. Well, again, Dr. Sand, thank you so much for blessing us and gracing us with your, not just your knowledge, but your presence. You've been a breath of fresh air and very engaging and enjoyable. So I really appreciate it. We're going to put links to her podcast and the website for her cosmetics line in the down in the show notes here in the YouTube description when this gets posted. So please. You see her doing her thing. Let's take part. Let's go get better, right?
Yes.
All right. Well, anything else?
That's it. I think it's been a great show.
All right. Dr. Sand, thank you again. We will have you back. So we'll tell you when to prioritize.
Have y'all on my podcast. More Shauni. I can have her on the podcast. I don't know. But I'm definitely going to have you on the podcast. This was really, 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 it was great. I really enjoy y'all energy. So thank you again.
Good deal.
Thank you. We would be happy.
We would be definitely happy to be there. For all of our viewers out there, thank you so much for this first show. Please leave comments, leave questions. Whatever you can put out there for us, let us know, because we want to make sure that you are being served well with this show. We want to make sure that you're getting educated, you're being informed, so that we can all be healthy and whole.
With mind, body, and soul.
We see everybody later. See you later, Dr. Sand. Take care.
Bye. Thank you.